Hi, my name is Laura Macke. I'm a nurse practitioner at MedStar Georgetown Lombardi Comprehensive Cancer Center. I work as a sub-I on many early phase clinical trials within our developmental therapeutics group. This is my second year at ASCO, and I have to admit I'm enjoying it quite a bit more this time around. I think it's such a massive meeting. I think the first time was really overwhelming, but this time I really planned in advance and gave myself plenty of extra time on the shuttles, so it's been great. Also downloaded the ASCO app this year, which has been nice to help organize the schedule and help me find my way around. Because of my specialty in developmental therapeutics, obviously those sessions are a favorite of mine. The Friday afternoon developmental therapeutics oral abstract session highlighted data about BL-B01D1, also known as Izabren. This is an exciting new bispecific ADC targeting EGFR and HER3 with the topoisomerase 1 inhibitor. The data from these studies were specifically around small cell lung cancer and non-small cell lung cancer with driver mutations outside of classic EGFR mutations. So, for example, exon 20 insertion EGFR, as well as several others such as ALK or KRAS. So the drug looks great, and it's one I'm particularly excited about because we have the BL-B01D1 Lung 101 trial at Georgetown. This data was particularly interesting to me. A lot of the toxicities that were reported in the studies from China are consistent with what I've been seeing in clinic, with manageable myelosuppression, GI toxicities, and fatigue. The data numbers looked great for small cell lung cancer. The overall response rate was 70%. And for the non-small cell with driver mutations, overall response rate was 46%, with patients with EGFR non-classical mutations doing particularly well with a 70% overall response rate. So that's some exciting data I look forward to bringing back to my patients at Georgetown. Another session I enjoyed today actually was the a session I enjoyed this morning was the symptom science and palliative care oral abstracts session, which was looking at a lot of interesting data for different approaches to challenges such as nausea, anxiety, neuropathy, things that our patients with cancer experience regularly. So that was a really special and unique session to observe as well. As nurses, we learned from day one that evidence-based practice is essential. Here at ASCO, we have the opportunity to see the new data firsthand and like you said, bring that back home right away to our patients. And I think it's an important two-way street actually, because while we're bringing this data to them, a lot of how we see the data is through their perspective. For a variety of reasons, nurses are able to spend more time with patients and are kind of entrenched in the day-to-day experience of cancer with the patients. So I think about this particularly in the context of the safety profiles of these drugs. What can I expect with these drugs coming down the pipeline? Are there prophylactic measures I can use to prevent my patients from experiencing some of these toxicities? And also, how do I manage these toxicities when they do happen? So being able to anticipate those things.